Okay, hi. This is my newborn assessment, and this is my newborn. First, obviously, I would introduce myself. Hi, I'm Sierra. I'll be your student nurse today. Is it okay if I assess your baby? Do you have any spiritual or religious concerns you would like for me to incorporate in your care today? And everything's fine, so I wash my hands, put gloves on. This baby was born vaginally a couple of hours ago. There were no complications. Her and mom don't have any injuries from birth. Her vital signs have been taken. You want her pulse to be between 120 to 160. You want her respirations to be between 30 to 60. You want her temperature to be between 97.7 to 99.6. So for this assessment, we're going to say that her vital signs are within normal limits. For measurements, you want her to be between 19 to 21 inches long. You want her to weigh between 5 pounds and 8 ounces to 8 pounds and 13 ounces. You want her head circumference to be between 12.5 to 15 inches, and her chest circumference should be 2 centimeters less than that measurement. So for this assessment, again, we're going to say she's within normal limits. So starting off for general assessment, you want to make sure her body alignment is good, she's symmetrical, she has good muscle tone. She will start crying at some point during this assessment for sure, so you'll be able to tell if she has an intense cry, high-pitched, aggressive, anything like that. You want to make sure she has all of her body parts and she can move all of her body parts. And yep, so moving on to her head, you want to palpate for the fontanelle. The anterior one should be a diamond shape, posterior should be a triangle shape. They should not be bulging or sunken in. Her head would probably be molded a little bit from vaginal birth, so her head would be a little bit elongated. Make sure it's not excessively elongated. Check for a cephalhematoma or a caput on her head. Check that her face is symmetrical and she can move her facial muscles, which you can tell she can because she's smiling. Her eyes are blue, but they would usually be gray. They're symmetrical. You want to check her conjunctiva, make sure there's no debris in there, there's no signs of infection, they're nice and pink, there's no lacerations. She would probably have a little bit of strabismus, probably have a little lazy eye. You check her perla. Her pupils should be equal, round, and reactive, but they're probably a little bit sluggish when they react, and accommodation is not present at this time. For her nose patency, you'll be able to check that when she's feeding, whether it be breastfeeding or formula feeding, because she will either stop and gasp for air because she's breathing out of her mouth, or she's able to breathe out of her nose at the same time. If she had ears, you would want to check that they're well formed and that they align with the corners of her eyes. For her mouth, you want to take your thumb, your gloved thumb, and run it over her palate. Make sure there's no openings. While you're in there, she will likely suck on your thumb, so you can check the sucking reflex there. Her swallowing reflex, you can check when you're assessing her breastfeeding or formula feeding. You can also check inside of her mouth for Epstein pearls. And when you assess her skin, since she's a few hours old, she probably doesn't have any vernix anymore. It's probably been washed off. But that's the white cheesy substance that coats their skin. She likely has some milia on her nose, or the tiny white bumps that like to be on the bridge of their nose. Erythema toxicum, or a rash with some little bumps in it, might be on her skin. Mongolian spots are birthmarks that look like bruises that you want to take note of because they are not bruises. You do not want to think they're bruises later. She probably has some lanugo on her skin, some little bit fine baby hairs. They like to be on their ears or on their shoulders or on their back. And yep, so her neck, you want to make sure that her clavicles are not broken. There's no openings, there's no trauma there, they're symmetrical. Her chest, you want to make sure that her chest movements are symmetrical bilaterally. Her breathing is symmetrical on both sides bilaterally. She might be abdominally breathing, so you want to make sure she's not struggling to breathe. It's not, yeah. You just want to make sure she's not struggling to breathe. You want to make sure that her entire torso in general, both her abdomen and her chest, should be symmetrical. Her nipples here should be an appropriate size for her size. You want to make sure there aren't any extra nipples. There's no discharge coming out of those nipples. There might be some engorgement, and there should be a breast bud underneath each nipple that measures 2 to 5 millimeters. So you want to check that. Her cord here, since she's only a few hours old, you will be able to see the 2 arteries in one vein, hopefully. Her arms and her legs, her muscles in general, she should have full range of motion of those. It should be a pretty equal range of motion. You want to make sure her hips aren't dislocated. You can move them in and out. Listen for clicking. She probably has some really jerky movements, and that's fine, that's normal. You want to count her fingers and her toes. She should have 10 of each. And for her palmar reflex, you can put your thumb in the middle of her palm. She should grasp it, like curl her fingers over your hand. Same with her foot. You should put your thumb there, and her toes should curl over your foot. Your hand, sorry. You can also do the Babinski reflex here, so run it over. Her toes should fan out. You want to check her genitalia. You want to make sure that the labia covers the clitoris. There's no discharge, there's no blood, there's no diaper rash. If it was a male baby, you want to make sure the urinary meatus is at the tip of the penis. You want to palpate the scrotum. Also check for discharge and rash and bleeding there, especially if it's any time near circumcision. You want to check that site too. She will not have voided urine or had a bowel movement yet because she's only a couple of hours old. Speaking of, you can listen to her bowel sounds here. They're likely very underactive if they're present at all. It depends on whether she's fed yet or if she's fed more than once yet. You want to check for a murmur. Sorry, my voice cracked. You want to check the apical pulse if you didn't do that during vitals. You want to listen to her lung sounds. There's likely stridor there, especially if she's on her back. And now you want to put her on her stomach and look at her back here. So while she's back here, you want to first look at the skin too. There's probably some lanugo again. It likes to be up here. You want to check that her spine goes straight down her back. It's good alignment. You want to make sure there's no openings in her spine. You can also check her gallant reflex by rubbing here. She should curve inwards. And here you also want to check that her anus is patent, especially if she hasn't had a bowel movement yet. You want to check her other reflexes. You want to check her Moro reflex. So you want to put her arms up and drop them, and she should have a startle reflex. You want to check her rooting reflex. She should turn her head towards whatever side you're rubbing. You want to check her tonic neck reflex. If you turn her head, the same side should curve up, and then the other side should come in towards her body. It's like a fencing position. You want to check her stepping reflex. So if I put her feet onto the table, she should try to look like she's trying to walk. I think that's all of them. So for the sleep stages, ooh, sorry girl. For the sleep stages, if she's in a deep sleep, she probably isn't moving. Her eyes are definitely not moving. She is probably having some really slow and quiet respirations. It might be a little bit hard to wake her up. She is not gonna startle with stimuli. If she's in a light sleep, she will startle awake. She will react to stimuli. She's having some rapid and irregular respirations. She's probably moving a whole lot. She's probably stretching, moving. She was probably making some sucking motions and sounds. And she will wake up. I don't remember if I said that. If she's in the drowsy stage, she could have her eyes closed, or they could be open and just glazy and unfocused. She could either startle awake from reacting to stimuli, or if there's no stimulus, she could just go back to sleep. In the quiet alert stage, she is really focused on her surroundings. She thinks her surroundings are really interesting. This is a good time to bond with mom. She isn't moving a whole lot because she's so focused. She will react to stimuli here too. In the active alert stage, she is very fussy. She's probably very upset because she just discovered that being cold and hungry sucks. So she's gonna let you know about it, and she's gonna be really mad. So you really want to try and comfort baby, especially because if you don't comfort her, it will lead her into the intense crying stage, and at that point you really need to comfort her because nothing else is going to happen other than her crying. Nothing will be accomplished unless you comfort baby. So at this point, everything has been assessed. So you want to hand her back over to mom. She's been only in a brief this whole time during the assessment, so that's a risk for her baby getting cold. So you want to put her back on mom, skin to skin contact, warm her back up. Let them know if there's anything you can do. If there's anything they need, let you know. And that's it.